If you want to know how to treat pancreatitis in intensive care for your husband or for your critically loved one, stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com, and I have another quick tip for families in intensive care. Today I have an email from Fatima who says, "Hi Patrick, my husband has been in ICU since last Monday. He has pancreatitis, so his pancreas has caused an infection in his body. He was on a ventilator for 3 days. Then he came out of ventilation and the induced coma. He looks very confused, but does remember me. They are giving him the antibiotics. My question is, how long will it take for him to get better?" From Fatima. Well, Fatima, thank you so much for asking that question. Well, the good news here is your husband has come out of the ventilation and induced coma within 3 days with a pancreatitis. That is really good. You know, that is really a quick turnaround. And the reason he's probably a little bit confused is as a side effect from the induced coma. What that means is he would have been receiving propofol or midazolam/Versed or Precedex and or morphine and fentanyl. And that knocks the body out, right? Because he would have been in a lot of pain as part of the pancreatitis, right? And when anyone with pancreatitis goes into ICU, it means it's a severe case of pancreatitis. And what happens in intensive care with pancreatitis, there's always a case for complications to happen. So, you know, it sounds to me like whatever treatment they've given him, whether it's antibiotics, they kept him nil by mouth, most likely. And they might have given him some IV fluids, because aggressive hydration with IV fluids is crucial to maintain blood pressure and prevent organ failure during pancreatitis. Like I said, strong pain management are often needed, such as opiates, fentanyl, morphine, right? And one of the main side effects of fentanyl and morphine during pancreatitis is respiratory depression. And if someone is on a ventilator, they don't need a side effect of respiratory depression, right? Because that could inhibit someone getting off the ventilator. And I'm glad to hear that your husband is off the ventilator already. So with pancreatitis, most patients are nil by mouth. So if your husband is not allowed to eat, well, especially if he's on a ventilator, he can't eat anyway. They may receive a little bit of nutrition by a feeding tube like nasogastric or nasojejunal tube, or IV nutrition, also known as TPN. Most likely he would have had TPN. Most patients in ICU with pancreatitis are nil by mouth, which excludes nasogastric tube or nasojejunal tube feeding. In many cases, like in your husband's case, ventilation is needed, right? Mechanical ventilation with a breathing tube is needed, and thank God it only took 3 days. Now, also because pancreatitis can cause sepsis and septic shock, in those situations, kidneys are failing or can be failing, right? If kidneys are failing, sometimes it is sufficient to manage with IV fluids, in combination with some diuretics such as furosemide or Lasix. And sometimes dialysis or hemofiltration is needed, right? You haven't mentioned any of it, but you know, you got to keep an eye on that. Sometimes there's a delay in the kidneys shutting down. With pancreatitis as well, especially with a septic or a septic shock picture, blood pressure support is needed, such as medications like vasopressors or inotropes might be needed if blood pressure drops too low, and there's a high chance the husband may have needed or may still need vasopressors and inotropes, such as levophed, norepinephrine, noradrenaline, phenylephrine, epinephrine, adrenaline. The names vary a little bit depending which country you're in, or dobutamine, or dopamine, or milrinone even. So what needs to happen here? Underlying causes need to be treated, such as gallstones. If pancreatitis is caused by gallstones, a procedure, ERCP, or surgery may be needed. But it doesn't sound to me like your husband had surgery. You've mentioned that antibiotics are used. if an infection is suspected, sometimes drainage or surgery is needed for infected pancreatic necrosis. You haven't mentioned any of that, but you gotta ask whether parts of the pancreas are potentially dead. Another thing that often happens during pancreatitis is that patients go with high blood sugars because the pancreas no longer can produce and excrete the insulin needed to regulate blood sugars, right? So find out if your husband has had some insulin or potentially is still on some insulin to manage high sugars. And also, what has triggered the pancreatitis? Is it alcohol? Is it medication-induced pancreatitis? You may want to find out. So what are complications and how to manage them? Pancreatic necrotic, or is it a pseudo cyst? If the tissue or fluid collections form, drainage procedures may be needed. Like I said, sepsis or systemic inflammatory response syndrome, also known as SIRS. If the inflammation spreads, leading to multi-organ failure, ICU care focuses on stabilizing vital signs, hemodynamics, ventilation, and the body. It sounds like that has happened already. Really, recovery depends on the severity of the condition and how the body responds to treatment. So, but what is really important, that your husband is already off the ventilator. That is really important to know. And that means hopefully he's turned the corner. And what are the next steps from here? The next steps from here is to start nutrition again, whether TPN continues for a few more days, and then maybe he can start to eat and drink slowly, or maybe nasogastric tube or nasojejunal tube feeds are necessary. That you will see over the next few days. Also ask if he is now insulin dependent for now. Because he's confused, make sure he gets back to normality as quickly as possible, which includes, going to have a shower, at least having a good bed wash, getting out of bed, sitting out of bed, walking around, even if he can do that, if he's stable enough, brushing teeth, just go back to a routine as quickly as possible. Because he's come off the ventilator, do deep breathing exercises, coughing exercises, so that he's not going to need ventilation again. If he's still on some oxygen, wean oxygen off. Those are all important things that need to happen next. And then hopefully he can go back to a hospital ward and leave intensive care as quickly as possible. This could take a few days, maybe even a couple of weeks. Pancreatitis is not to mess around with. It's quite a severe infection, especially if it required an intensive care stay. So that is my quick tip for today. I hope that helps Fatima. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very confidently say that we have saved many lives with our consulting and advocacy. And I can verify that for you if you go to intensivecarehotline.com, if you look on our testimonial section, and you can see what our clients say. And you can also verify that on our intensivecarehotline.com podcast section, where we have done client interviews. With all of that said, our advice here is absolutely life-changing. And because we have saved so many lives, it is quite literally life-changing. And we have helped hundreds and hundreds of members and clients over the years, and you can join a growing number of clients and members that we have helped to improve their lives instantly, making sure they make informed decisions, have peace of mind, control, power, and influence when they have a loved one critically ill in intensive care, making sure their loved ones get best care and treatment always. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I handhold you through this once-in-a-lifetime situation when you have a loved one critically ill in intensive care. And I make sure we leave no stone unturned, which includes talking to doctors and nurses directly so that you can get a second opinion pretty quickly. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Like the video, click the notification bell, share the video with your friends and families, and comment below what questions you have or insights you have and what you want to see next. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you're a subscriber to my email, to my YouTube channel, or to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.